Have you ever wondered whether the discomfort you've been experiencing over the past few months is simply ordinary acidity or something far more serious? Perhaps your stomach feels unusually heavy after eating. You may notice a mild ache in the upper abdomen, your appetite isn't what it used to be, and you've even lost a little weight without trying. Most people assume it's because of the weather, a recent change in diet, or simply getting older. That assumption can become a dangerous mistake. Stomach cancer is one of the most common cancers worldwide, and one of its most alarming characteristics is that it often develops silently. In its early stages, it rarely causes dramatic warning signs. Instead, it produces subtle symptoms that many people ignore for months or even years. These seemingly ordinary discomforts are often your body's quiet way of asking for attention. In this video, you'll learn about the early warning signs of stomach cancer that many people fail to recognize. We'll discuss when it's important to seek medical attention, who is at greater risk, how doctors diagnose the disease, and the common mistakes many people make that delay treatment. Remember one important fact: awareness is not a cure, but awareness can lead you to timely diagnosis and effective treatment. Before discussing the symptoms, it's important to understand how stomach cancer develops. Once you understand what happens inside the stomach, the warning signs become much easier to recognize. The stomach is a muscular organ that processes several pounds of food every day. Its inner lining contains millions of cells responsible for producing stomach acid, digestive enzymes, and protective mucus. These cells constantly renew themselves, replacing old cells with new ones every few days. While this rapid renewal is essential for healthy digestion, it also creates opportunities for mistakes during cell division. Occasionally, a cell develops an abnormal genetic change. Normally, the body's repair systems detect and correct these errors. However, if the damage continues to accumulate and the repair mechanisms fail, abnormal cells may begin multiplying uncontrollably. Over time, these abnormal cells can develop into cancer. Stomach cancer usually doesn't result from a single cause. Instead, several risk factors often work together over many years. One of the most significant causes identified through medical research is an infection with Helicobacter pylori, commonly known as H. pylori. This bacterium is unique because it can survive in the highly acidic environment of the stomach. It spreads through contaminated food, water, shared utensils, or close personal contact with an infected individual. Once inside the stomach, H. pylori can cause long-term inflammation of the stomach lining. This chronic inflammation gradually damages healthy cells and increases the likelihood of abnormal cellular changes that may eventually lead to cancer. Other lifestyle factors can also contribute to this process. Consuming excessive amounts of salt can damage the stomach lining over time. Diets high in pickled foods, heavily salted meals, processed foods, and preserved products may increase the risk. Smoking introduces harmful chemicals that damage stomach tissues and further raise the likelihood of developing stomach cancer. A family history of the disease can also increase a person's genetic susceptibility. It's important to understand that these harmful changes do not occur overnight. Stomach cancer usually develops slowly over many years, rather than within weeks or months. During these early stages, the body often compensates for the damage, meaning there may be no obvious symptoms at all. By the time noticeable signs appear, the disease may have already progressed. This is exactly why recognizing the earliest symptoms is so important. One of the first warning signs is feeling unusually full after eating only a small amount of food. Imagine sitting down for a normal meal, perhaps rice, vegetables, and bread. After eating only half your usual portion, you already feel completely full. Even an hour later, your stomach still feels unusually heavy, almost as though you've overeaten. Doctors refer to this symptom as early satiety, which simply means becoming full much sooner than expected. Why does this happen? When an abnormal growth develops within the stomach, even during its early stages, it can reduce the stomach's ability to stretch normally. A healthy stomach expands comfortably as food enters. However, when part of its wall becomes stiff or abnormal, it cannot expand properly. As a result, even small meals create a sensation of fullness and heaviness. Many people mistake this feeling for simple indigestion or acidity. They take antacid medications, and sometimes the discomfort temporarily improves. Unfortunately, that temporary relief often convinces them that nothing serious is wrong, allowing months to pass without proper medical evaluation. So how can you tell the difference? Typical acid reflux or acidity often causes a burning sensation before meals that improves after eating. In contrast, if you consistently feel heavy and unusually full after meals for more than 3 weeks, especially if standard acidity medications provide little or no lasting relief, the problem may be more than simple indigestion. At that point, consulting a healthcare professional becomes essential. Another important warning sign is unintentional weight loss. Losing weight without trying may seem harmless at first, but understanding why it happens is important. When abnormal cancer cells grow anywhere in the body, they consume energy that would normally support healthy tissues. At the same time, the body releases inflammatory chemicals that suppress appetite. Eating less while your body uses more energy creates gradual but noticeable weight loss. This isn't just the loss of body fat. Muscle mass also begins to decrease, a condition doctors call cachexia. Clothes become looser, the face may appear thinner, and overall strength gradually declines. Many older adults assume this weight loss is simply a normal part of aging. While small changes in body weight can occur with age, losing 5 kilograms or more within 2 or 3 months without changing your diet or exercise routine should never be ignored, especially if it is accompanied by a reduced appetite. Another warning sign that should never be ignored is persistent pain or discomfort in the upper abdomen. Picture the area between your chest and your belly button. This is where your stomach is located. If you experience a dull, ongoing discomfort in this region that refuses to go away, it deserves attention. The pain may not be severe, but its persistence is what makes it concerning. Conditions like gastritis and stomach ulcers can also cause pain in this area, but there are important differences. Ulcer pain often becomes worse when the stomach is empty and improves after eating because food temporarily neutralizes stomach acid. Gastritis may cause discomfort after meals due to irritation of the stomach lining. Stomach cancer, however, usually doesn't follow a predictable pattern. The discomfort may be present regardless of whether you've eaten or not. It may linger throughout the day and in some cases spread toward the back or between the shoulder blades if the disease begins affecting nearby tissues. If you've been treating persistent upper abdominal pain as simple gas or indigestion for several weeks or months without lasting improvement, it's time to seek medical evaluation rather than continuing self-medication. Another symptom that deserves careful attention is recurring nausea and vomiting. Almost everyone experiences nausea occasionally due to food poisoning, travel sickness, medications, or viral infections. These episodes usually resolve quickly. The nausea associated with stomach cancer is often different. It frequently appears shortly after eating, almost as though the stomach is struggling to accept food. Instead of disappearing after a day or two, it continues returning over several weeks. An even more serious warning sign is vomiting blood. The blood may appear bright red, or it may look dark brown and resemble coffee grounds. This darker appearance occurs because the blood has been partially digested by stomach acid before being vomited. This situation requires immediate medical attention. Some medications, particularly pain relievers such as ibuprofen or aspirin, can also cause stomach bleeding. However, it is impossible to determine the exact cause without proper medical evaluation. Never assume that bleeding is simply a side effect of medication. Changes in bowel movements can also provide valuable clues. Many people hesitate to discuss their stool, but ignoring these changes can delay the diagnosis of serious illnesses. If your stool becomes black, sticky, and tar-like, doctors refer to this condition as melena. It often indicates bleeding somewhere in the upper digestive tract, including the stomach. As blood travels through the digestive system, stomach acid changes its appearance, turning the stool dark black. Some people become confused because iron supplements can also darken stool. While this is true, iron typically produces a dark green or dark brown color. Stool caused by internal bleeding is usually jet black, sticky, and often has an unusually strong odor. If you are not taking iron supplements and suddenly notice black tarry stool, you should contact a doctor immediately. Another important warning sign is difficulty swallowing. This symptom usually develops when a tumor forms near the upper part of the stomach, close to where the esophagus connects to the stomach. You may feel as though food gets stuck while swallowing. There may be mild discomfort behind the breastbone, or solid foods become increasingly difficult to swallow while liquids continue to pass without much trouble. Many people mistakenly blame these symptoms on acid reflux or a throat infection. A throat infection generally improves within several days. However, if swallowing problems continue for weeks without obvious signs of infection, further medical evaluation becomes necessary. Persistent fatigue is another symptom that often develops gradually. Many people simply assume they're getting older or working too hard. However, constant exhaustion can sometimes indicate an underlying medical condition. If a stomach tumor bleeds slowly over time, even in very small amounts, the body gradually loses iron. As iron stores decline, hemoglobin levels fall, leading to iron deficiency anemia. Hemoglobin is responsible for carrying oxygen from the lungs to every organ and tissue in the body. When hemoglobin levels drop, less oxygen reaches your muscles and organs, causing weakness and fatigue. You may wake up feeling exhausted despite a full night's sleep. Walking upstairs leaves you short of breath. Simple daily activities suddenly require much more effort than before. Many people respond by purchasing iron supplements without consulting a doctor. While iron tablets may temporarily improve blood counts, they do not address the underlying cause of the blood loss. Treating anemia alone is not enough. Finding out why the anemia developed is far more important. Another symptom that may appear in more advanced stages is abdominal swelling caused by fluid buildup. This condition is known medically as ascites. When stomach cancer spreads or begins affecting the liver, fluid may accumulate inside the abdominal cavity. As a result, the abdomen gradually becomes enlarged and feels unusually heavy. People often notice that their clothes become tighter around the waist even though they continue losing weight overall. Many individuals mistakenly believe this swelling is caused by kidney disease or liver problems alone. While those conditions can certainly cause fluid retention, stomach cancer should also be considered as a possible cause, particularly when other warning signs are present. If you experience persistent abdominal swelling together with unexplained weight loss or ongoing digestive symptoms, do not delay seeking medical advice. One of the biggest reasons stomach cancer is diagnosed late is because people repeatedly dismiss their symptoms. Many individuals assume their discomfort is simply due to spicy food, indigestion, or acidity. They drink herbal tea, take over-the-counter antacids, and feel temporarily better. Unfortunately, this temporary relief often creates a false sense of security while the underlying disease continues to progress. Another common reason for delaying medical care is fear. Some people avoid seeing a doctor because they are afraid of what the tests might reveal. While this fear is understandable, postponing medical evaluation only allows the disease more time to advance. The reality is encouraging. When stomach cancer is detected early, treatment is often much more successful, and many patients can achieve long-term recovery. Once the disease reaches advanced stages, treatment becomes significantly more difficult. The difference often comes down to one thing: early diagnosis. There are several misconceptions about stomach cancer that often prevent people from seeking timely medical care. The first misconception is that cancer always causes severe pain. In reality, early-stage stomach cancer may cause little or no pain at all. Many people experience nothing more than mild indigestion, reduced appetite, or a feeling of fullness after eating. By the time severe pain develops, the disease may have already progressed significantly. Never assume that the absence of pain means everything is normal. Another common myth is that an endoscopy is extremely painful. Today, endoscopy is a routine and highly effective procedure. In most hospitals and medical centers, it is performed under light sedation, allowing patients to remain comfortable throughout the examination. The procedure usually takes only 15 to 20 minutes and provides doctors with a clear view of the inside of the stomach. Many people also believe that if no one in their family has had stomach cancer, they are completely safe. While a family history does increase the risk, it is not the only factor. Chronic H. pylori infection, smoking, unhealthy dietary habits, and long-term stomach inflammation can all contribute to the development of stomach cancer, even in people with no family history of the disease. Another dangerous misconception is that home remedies can cure stomach cancer. Certain healthy foods may help reduce the overall risk of cancer and support digestive health. But once cancer has developed, no herbal remedy, natural supplement, or home treatment can eliminate it. Proper medical diagnosis and treatment are essential. If your doctor suspects stomach cancer based on your symptoms, the first and most important test is usually an upper gastrointestinal endoscopy. During this procedure, a thin flexible tube with a tiny camera and light at its tip is gently passed through the mouth into the stomach. This allows the doctor to carefully examine the stomach lining for ulcers, inflammation, abnormal growths, bleeding, or suspicious tissue. If an abnormal area is found, the doctor can immediately collect a tiny tissue sample. This process is called a biopsy. The biopsy is then examined under a microscope by a pathologist who determines whether the cells are healthy, abnormal, or cancerous. A biopsy remains the most reliable way to confirm a diagnosis of stomach cancer. Additional laboratory tests are often performed as well. Your doctor may order tests to detect H. pylori infection using blood, breath, or stool samples. A complete blood count, CBC, can identify anemia caused by chronic internal bleeding. If cancer is confirmed, imaging studies such as a CT scan are usually performed to determine whether the disease is confined to the stomach or has spread to nearby lymph nodes or other organs. This process, known as staging, helps doctors select the most appropriate treatment plan. When stomach cancer is diagnosed in its earliest stage, surgery may completely remove the tumor before it spreads. More advanced cases may require chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these treatments. The treatment plan always depends on the patient's overall health, age, and the stage of the disease. Although everyone should be aware of the warning signs, certain people need to be especially vigilant. Adults over the age of 50 are at greater risk because the effects of long-term cellular damage accumulate with age, while the body's natural repair mechanisms become less efficient. Anyone with a previous H. pylori infection should ensure that the infection has been completely eradicated. If treatment was incomplete or follow-up testing was never performed, it is important to discuss repeat testing with a healthcare provider. People who have a parent, sibling, or close family member diagnosed with stomach cancer also face a higher risk. Instead of waiting until symptoms become severe, regular medical checkups and earlier screening may be appropriate. Long-term smokers should also recognize that tobacco doesn't harm only the lungs. Many harmful chemicals from cigarette smoke eventually reach the stomach and contribute to ongoing damage of the stomach lining. Individuals diagnosed with pernicious anemia require regular medical follow-up as well. This condition interferes with vitamin B12 absorption and increases the long-term risk of stomach cancer. Fortunately, there are practical steps you can take to reduce your risk. If you frequently experience indigestion, heartburn, persistent nausea, or recurring stomach discomfort, ask your healthcare provider about testing for H. pylori. If the infection is detected, complete the entire course of prescribed antibiotics exactly as directed and return for follow-up testing to confirm that the bacteria have been eliminated. Reduce excessive salt intake by limiting processed foods, heavily salted snacks, pickled foods, and preserved products. While enjoying these foods occasionally is unlikely to cause harm, frequent consumption over many years may increase the risk of stomach damage. Build your diet around fresh fruits and vegetables. Foods rich in antioxidants, including tomatoes, spinach, carrots, leafy greens, onions, and garlic, help protect healthy cells from oxidative damage and support overall digestive health. Avoid frequently eating heavily charred or burnt meat. Cooking meat at extremely high temperatures can produce harmful compounds that may increase cancer risk over time. Pay close attention to persistent symptoms, especially in older family members. Many elderly individuals dismiss ongoing stomach discomfort as a normal part of aging and delay seeking medical care. Sometimes, encouragement from family members can make all the difference. Certain warning signs require immediate medical attention. Seek urgent medical care if you vomit blood, notice black tar-like stools, develop sudden severe abdominal pain that rapidly worsens, feel a new lump or hard area in your abdomen, or lose 5 kilograms or more within 2 to 3 months without trying. These symptoms should never be ignored or postponed. Finally, remember that this video is intended for educational purposes only. It provides general medical information and should never replace professional medical advice, diagnosis, or treatment. Every individual is different, and only a qualified healthcare professional can evaluate your symptoms, medical history, physical examination, and test results to determine the correct diagnosis. Today we've discussed far more than a simple list of symptoms. We've learned how the body often sends subtle warning signals long before a serious disease becomes obvious. Feeling unusually full after meals, losing weight without trying, persistent upper abdominal discomfort, unexplained fatigue, nausea, or changes in bowel habits may appear minor on their own, but together they can provide important clues that should never be overlooked. If you are over 50 years of age, have a history of H. pylori infection, smoke regularly, or have a family history of stomach cancer, take these warning signs seriously. If any symptom persists for more than 3 weeks, don't wait for it to disappear on its own. Schedule a medical evaluation as soon as possible. Your health is one of your greatest assets. Paying attention to your body's early warning signs today could make a life-changing difference tomorrow. Thank you for watching. If you found this information helpful, please like this video, share it with your family and friends, and subscribe for more evidence-based health education. Stay informed, stay proactive, and take good care of your health.